I found that I really liked care of adult patients, so that in adult patients, genetics, it really ends up being medical oncology, where you find that you're changing management and changing treatment plans based on genetic testing. My specialty is hematology, oncology, and cancer genetics. I see patients with genitourinary malignancies and also patients with genetic predispositions to cancer. People with kidney cancer, people with bladder cancer, prostate cancer, more rarely testicular cancer, and then with genetic predispositions to malignancies, most typically men with BRCA1, BRCA2 gene changes, some other gene changes, also people with genetic predispositions that are a little bit more complicated, require a little bit more complex surveillance. One of the things that made me pick medical oncology is that I see my patients frequently, so I like seeing them on a regular basis. We work as a team with our physician's assistants, nurse practitioners, so sometimes we're alternating visits, but that's one of my favorite things. I get to know my patients closely. I'm sort of the quarterback of the team, and I often end up being one of the providers that gives continuity care, that continues following patients every 3 months, every 6 months. It is a very individualized care approach. I would say, especially on that first visit, I like to talk really in depth. Often the first visit ends up being a longer visit. I also like to use a broad range of genetic testing to come up with an individualized treatment plan for patients. We discuss, I make recommendations. Often patients ask me, what would I do for myself, or what would I do for a family member? But at the end of the day, it's up to the patient that they're deciding what sort of treatment plan they're going to embark on. When we can get somebody's cancer under control, and maybe they didn't expect for it to be kept under control, and where we can be monitoring or sort of develop a routine that works for the patient and keeps their disease under control while letting them live their lives. The other thing that I find rewarding is when we can catch a cancer early in those that have genetic predispositions to cancer with enhanced surveillance. When I'm not seeing patients, I like to run. I like to work on fixing up the house and the garden, and also spending time with my young daughter.